The flu goes viral. Good evening. I'm Maurice Dubois.
I'm John Dickerson. The flu is doing what viruses do, especially this time of year. It's spreading. But we're beginning with this story tonight because it is spreading more rapidly than usual.
This is shaping up as the worst flu season in more than 15 years since the swine flu pandemic of 2009. Take a look at the map. There are flu cases now in every state in the union, but the virus is most active in these 43, which have 97% of the U.S. population.
Those states with a high rate of flu include Indiana, and Janet Shamlian is in South Bend. Janet?
Good evening. As we made our way around the middle of the country reporting this week, we heard from doctors and nurses who told us that this year's flu season is hitting harder than any since before the pandemic. And that was certainly true when we visited Louisville.
In the emergency room at Louisville's Norton Children's Hospital, we found the staff treating a surge of pediatric flu patients.
We've had more than 1,800 kids test positive this week, and it's only Wednesday.
Pediatric specialist Dr. Chris Bryant told us last week there were 3,000 flu cases.
How does this flu season compare to previous years?
It's certainly worse. We are seeing extraordinarily high numbers of kids test positive for flu. It's worrisome.
Across the country, there have been more than 24 million flu cases this season. That's almost 10% more than this time last year. Fewer are dying, but flu-related hospital visits are up almost 25%. In Kentucky, teachers sanitized classrooms. Schools in Jefferson County went to remote learning, and schools in Bullitt County, a half hour south of Louisville, have been closed since Wednesday to try to stop the spread. The percentage of children getting the flu vaccine is the lowest in 6 years. The CDC reports this year, fewer than half have been vaccinated.
Do you think that vaccine hesitancy plays into some of these low rates?
I suspect vaccine hesitancy does play a role as well.
We also met Casey Hoover. She's a pediatric nurse and mom. When her daughter's symptoms turned serious, she grabbed for her phone.
I called immediately that morning, made an appointment to get her tested because I knew that was important.
How sick was Emerson?
She was really sick. I would say the sickest that she's ever been in her entire life.
Emerson is 6 years old. She contracted the virus despite getting a flu shot.
I think she would have been a lot sicker had we not gotten that flu vaccine.
Emerson is better, but still home because her elementary school closed this week after more than 20% of its students came down with the flu. Dr. Bryant had a message for families. It's not too late for a flu shot.
We tend to focus on flu as a respiratory viral illness, but some parents don't realize that it can cause seizures, even rarely an inflammation of the brain. And pediatricians are reporting cases of that across the U.S.
Here in South Bend, Indiana, home of the Fighting Irish, medical staff here at the Beacon Health System that told us that 15% of the people hospitalized right now, children and adults, are fighting some type of respiratory infection.
Janet, as parents, we've all been there in one way or another. What's the advice from doctors if you think your child has the flu?
Yeah, act sooner rather than later. Call your pediatrician, get a flu test. Getting your child on Tamiflu sooner will shorten the duration of the recovery. And keep in mind, respiratory symptoms are not the only symptoms. The little girl in our story, she was breathing just fine. She had loss of appetite, stomach ache, lethargic, and sure enough, it was the flu.
And Janet, following up on what Maurice is saying, those doctors, what do they say about the fact that Emerson was already vaccinated?
Yeah, so the flu vaccine, they say, is not 100% effective. And the flu virus mutates and changes from year to year, but they still suggest that you get it. They believe that it will lessen the severity if you do contract the flu.